I'm Julius Oatts. I'm a pediatric ophthalmologist on faculty here at UCSF, and I'm also the Associate Residency Program Director for Ophthalmology. So on a day-to-day basis, I treat and do surgery for kids with eye disease, and specifically glaucoma. And one thing that excites me about my job is that I take care of not only the child, but the entire family unit. So I find joy in advocating for these young patients and also empowering their parents with information to best understand their eye condition. The stakes can be high, but also gratifying because you have the opportunity to prevent vision loss or even blindness for the rest of a child's life. So you can imagine that examining a child has limitations and we're not always able to get as much information about their eyes as we'd like, and that's an area I'm interested in. So how can we get the most information about a child's eyes while keeping them comfortable? How can we make sure that the information that we get is accurate? And how can we apply innovations from adult glaucoma diagnostic and surgical care to childhood glaucoma? So I'm really interested in optimizing the eye exam for kids, and we're working on a few projects to look at this. One is using a virtual reality platform to test for peripheral visual field loss, so it makes it kind of more like a video game. Another is an augmented telehealth program where we empower parents with the tools to assess aspects of their child's eye health at home, so we get a more longitudinal view of their condition. So when I think about the legacy of Dr. Watson, I think about the phrase representation matters, and it actually reminds me of a patient that I saw. So I walked into the room, I introduced myself, and he looked at me and he said, "You're my doctor?" And I had this moment where I realized he had never seen a doctor that looked like him. And so the wheels are turning in my head, and I'm thinking back, when I was a kid, I never had a doctor that looked like me either. So I examined his eyes, wrapped up the visit, and at the end I said, "You know, if you want, you can be a doctor too." And I felt really proud to be able to say that, and also proud to see that he believed me. So I am honored, really, to be continuing Dr. Watson's legacy of both innovation and representation in medicine. Approaching kids in the clinic can be a very different experience, and you have to cater the specific maneuvers or information to them. So one thing that we're able to do really well in the pediatric ophthalmology clinic is cater our expectations and our innovations in the way that we examine kids in a way that centers them and centers respect for the child and their family. There's not a lot of pediatric ophthalmologists. You can't see 50 patients in a day and be a high volume surgeon because kids take a little bit longer to coax information out of. So for that reason, we see kids from all over Northern California and the Central Valley that have nowhere else to go besides here. And we happily see them and are able to provide a service that they don't have access to closer to home. One advantage of COVID has been allowing us to rethink the way that we've done things in the past. One thing that we've changed is converting post-operative visits for routine cases to telemedicine visits. And it's an innovation that maybe we wouldn't have considered before COVID, but really has changed the scope of our post-operative care for patients, is preventing unnecessary drives to the hospital and generally improving patient satisfaction. It's always nice to have a fresh set of eyes on a problem that you've been turning over in your head for a while. So I'm really looking forward to being part of the John A. Watson Scholar cohort and having 20 fresh sets of eyes to help me consider problems that I've been thinking about in research and questions I'm excited to answer.